if I'm told that that's never going to happen, I can't even explain how I would react. Like, it would probably destroy me, if I'm honest. But I don't know.
When our health falters, the impact can be dramatic.
What is it? Tell me.
I just hate it so much.
But often, it's our partners and our loved ones that suffer just as much.
It's almost like having a third person in the relationship.
How could you want to look at that and be attracted to it?
Are you here alone?
Yeah, by myself, really.
With top in-house specialists on hand to treat his patients.
Lean back towards me.
Well. Good morning. How are you?
World-renowned Dr. Christian Jessen has set up a state-of-the-art clinic to give people from across Britain the kind of care that sometimes fails to reach them.
How can I help?
It's not every day you get to be seen as a whole person rather than your condition.
That's why I love my job.
I do feel like I'm a burden.
Yeah. Why though? It's nothing you've done, is it?
Just feel like I'm not getting better.
Every step of their journey will be captured as they share their most vulnerable moments and intimate problems.
Sorry.
It's okay.
In the hope of solving issues at the very heart of their lives.
I've got that one at the front there.
I worry that I'm not going to get to see my children grow up. And that scares the life out of me.
I'll have the opportunity to talk to partners, to mothers, to daughters, as well as the patient themselves, really to try and pick up all the pieces and to address the sometimes very complex emotional problems that come hand in hand with the underlying condition.
I finally have answers. It's amazing, absolutely amazing.
There's actually hope.
Good morning.
Oh, good morning.
How are you? What are you up to tonight? Have you got plans?
All I do is eat food, so I'll go home, put some food on, and chill out.
You're very slim for someone who all she does is eat food. Yeah.
You don't eat a lot.
No.
You got a nice body, man. You got a donkey there.
A what?
A donkey.
That sounds so rude. Have I got a donkey or not?
You haven't got a donkey.
I want to know what that is. What is it?
Bom. It's your bum.
Ah, bom in Portuguese. Yeah, that's me told. I've learned so much. I've learned
You're learning every day with this one, aren't you?
We better do some work, haven't we?
Yes, let's start our day.
So,
fabulous.
See you later on.
Have a good day.
You too. Bye-bye.
Bye.
But donkey.
Per donkey.
Hello. Okay, please come in. Thank you.
Hi, how's it going?
Good, thank you. Can I have a surname, please?
It's Docherty.
Please sign in for me.
So I'm an international flight attendant and I work for a well-known airline. Travel around the world with it and absolutely love it.
Take a seat.
Thank you.
Someone smells really nice.
I think it's me.
Me and Darryl trained together for work and we've been living together for the last 3 years.
Look at my hands.
We both just really care for each other. He cooks for me, he cleans for me. I'm a bit of a princess, so he does look after me a lot in that respect.
You two make such a nice couple. Check you
Really?
out, eh? Both of you. Yes, you.
This is my best pal, believe it or not. Everyone always says, oh, you two should be married or something, and we're like, no. Laura's like my best friend. She's really supportive. She's like my backbone, to be honest. I couldn't see myself living with anyone else.
Get married.
You never know, Darryl.
No, you never know exactly. I've never actually been in a relationship before. And yeah, for the age of someone who's 24, it's kind of like unheard of, isn't it? But if I don't feel good about myself, I don't really expect someone else to feel good with me, if that makes sense. I'm really paranoid about the condition that I've got.
Dr. Christian will see you now.
It's the very first thing I think of in the morning, and it's the last thing I think of at night. Thank you.
It's just frustrating for me to see someone that I love so much, and is generally the nicest person I know, to be plagued by this issue which completely rules his life. And it would just make me happy to see him happy.
Hey, how are you, Darryl?
I'm very well, how are you?
Nice to meet you.
And very nice to meet you as well. How are you?
Come and have a seat. I'm all right. I'm all right. What can I do for you?
Approximately 5 years ago, I'd lost about 8 stones in weight.
8 stone?
Yeah.
Wow.
I managed to lose over 100 pounds.
Yeah.
So I was quite a big chap. I've been left with quite a lot of excess skin around my chest, my stomach and my back and things.
Yeah.
Last year, I went to South America and actually had a tummy tuck procedure.
You did? Okay.
Yeah.
How did that go?
Initially, it went really, really well. But then, because I've got so much skin around my chest and my stomach, obviously gravity's kind of taking place, and now I've kind of been left with like a bump over like my tummy tuck scar.
Yeah.
So I feel as if I've taken 1 step forward and 2 steps back, and I'm in kind of in the same position as I was before I even went to have my procedure.
And how's this sort of excess skin bothering you? How does it get in the way? How does it affect things day to day?
Quite a lot, to be honest. This just overtakes my life, you know, this like excess skin, and I just want it to change. I'm a 24-year-old guy, but I feel as if I'm in somebody else's body, if that makes sense. I've never been on a beach where I can take my top off. I've never been in a relationship before. It's just little things like that in my life. It all boils down to this, and it's crumbling at me inside, you know.
My name's Danielle Di Rosario. I'm 26 years old and I'm currently living in Glasgow with my partner, Kevin.
Hello.
Hiya.
How are you both?
Not bad, you?
I currently work for Clydesdale Bank and I'm a service officer, which is basically just a fancy name for administrator.
Thank you. Take a seat.
Thanks. I would describe myself as small, bubbly, quite banterous. I'm always up for a laugh.
Are you two partners?
Yes. Yeah.
Oh, how long's it been now?
2 years.
2 years.
We match like you wouldn't believe.
Whoa.
Yeah. It's hard to determine whether it was love at first sight because you don't know the person that well, but I knew he was going to be a big part of my life.
For me, it was. We actually met on an online dating app.
Really?
Yeah.
You're joking?
No. And I was in a pub and I said to him, if you want to come and meet me, I'm here. And not even half an hour later, he showed up. Yeah.
You were keen?
Yeah, well, I mean, she's beautiful and that, so.
You're going a bit red.
Me, I know.
Oh.
I want to have a look
of course.
at you, see, you know, what you're talking about, so I understand.
I wear a surgical garment every single day. I've been wearing that for the last like 5 years, and the reason being because I feel as if it like compacts all my excess skin.
How much of a struggle is it to kind of?
It's a little bit of a challenge because it's like a full-on bodysuit. Yeah.
Do you challenge yourself, as it were, and then I will come over and have a look. All right.
Of course.
All right. It is a little bit Shakespearean outfit, that, isn't it?
Yes.
So, all right, let's have a look. So you tell me what you don't like, then.
It's just like everything around my back, sides my chest.
Okay. Where's the procedure done at the front? Let's have a look.
The worst part for me is all this. You know, when I'm like,
I understand.
tired of it.
You might be being a bit overly critical. Are you looking for perfection? Because
No. I'm not expecting miracles at all. Like I just think anything's an improvement, you know.
pop your things on. Pop your things on. All right, that's fine. And then let's talk. The first thing to say is yes, I see.
Yeah.
Okay, I do see.
It sounds really, really dramatic, but I physically can't look at myself.
I am really concerned about your expectations of what can be achieved and what can't be achieved.
Yeah, of course. Yeah.
And we need to get that right. So I have a surgeon that I think you should have a chat with. Stop getting excited. You're going to talk things through.
Yeah.
I don't want you making any decisions today.
Yeah,
You're banned from making decisions today,
okay.
all right? You're not allowed to say anything as far as yes or no or maybe, all right?
When I was really, really big, I didn't leave the house for a few months. I actually quit my job. I actually got that bad that I was just living in my bedroom. I get so paranoid about like the way I look, but I just feel as if I've still got the old me hanging over me all the time, and I just want to move on with my life and just just start fresh.
You know, what you've been through is fairly traumatic. You're not comfortable, you're not happy, you're not going out. There's all sorts of issues going on. And I will say to you this, surgery is not going to solve all of those issues. It's not.
Who's howling?
Yes, I got the piss.
Hello, Angela speaking.
Can you send Danielle and Kevin down to me, please? Thank you.
Kevin and Danielle, Dr. Christian will see you now.
Okay, great. My condition, I mean, it puts on quite a bit of pressure on the relationship because, I mean, we have stupid arguments. You say last door on the right?
Last door on the right. It really affects her, to be honest. It's something that can get her really, really down because she feels like she's failing.
Kevin.
Hi,
how are you?
Not
Nice
bad,
to meet you. I'm Christian.
Nice to meet you.
Danielle, hello, welcome.
right.
You come and have a seat here, Danielle. Kevin, you go there. Okay. Danielle, what can I help you with?
Basically, I've been struggling with my fertility for the past year, and we kind of hope that you would have a little look into it for me and see what's going on.
Tell me a little bit of the background then.
I was diagnosed with polycystic ovaries when I was 17. Was told not to worry about it at that point because obviously I wasn't ready to have a family and that. But now we've been trying for a while and not getting anywhere. And we kind of felt like we were hitting a brick wall trying.
Polycystic ovarian syndrome and polycystic ovaries is a condition I think a lot of people find quite hard to understand. In the simplest terms, it's a collection of cysts around the outside of the ovary, but in the rest of the body are underlying hormonal problems, increased androgen levels, insulin doesn't work so well, the patient can gain weight, her periods can become very irregular, and she can find it hard conceiving.
How long have you been trying for then?
Just over a year.
Just over a year.
Yeah.
How often? Without all the details, but roughly.
It was quite often to start off with, but after time's gone on, we just kind of started...
You probably got a bit tired, to be honest.
It's slowed its pace.
Because of the stress and that of us not conceiving and stuff, it's kind of putting a strain on the relationship. So it's probably not as often as it used to be, but we're still trying. Okay.
Have you argued about the whole sex life?
Yeah.
When and how many times? And
We've argued about that.
Why do you not want to do it today? What's wrong and all that?
That's the main argument that we have that causes petty arguments over nothing.
Because the work that I do is quite physical, you know, and I do get quite tired and that from it and stuff. So when Danielle seems to always want to do it.
Not always. That's an exaggeration.
Never heard a man complaining about that before. I hear you, of course I do.
No,
but this is the danger, and this is something I want you to listen to, because sex between you should be the ultimate kind of joy in a way, shouldn't it? Yeah. And if it's becoming routine and laborious and you've got some bloody app that's beeping and telling you when you've got to do it, it takes all the spontaneity and it just becomes quite routine and quite tedious, and I just like to put my feet up and watch Corrie, you know, sometimes. I mean, how much do you want to have children? Is this a big issue for you then?
It's everything to me. I really want a family, and I want a family with Kevin.
Okay.
And as it stands, it feels like it's never going to happen.
All right.
There's something in my eyes. Yeah, I can see. Hold on. Look at my... Can you see there's something?
Where is it about? No, can't see anything.
Hello.
Hello.
How are you both?
Not too bad. Thank you.
Can I have your surname, please?
Stanley.
Please sign in for me here.
My name's Rhiannon Stanley. I'm 20 years old and I'm from Leicester. I work in an office as a junior buyer. I live with my mum and our 3 dogs.
Thank you. Take a seat.
My boyfriend Dan is 21 years old. We've been together now for about a year, 3 months. I love everything about him. He just makes me smile, makes me happy.
Are you two all right?
Yeah.
How did you two meet each other?
I was working at a pub and she was a regular there.
Did you approach her?
Actually, no. You offered me to go around yours for pre-drinks for a night out, didn't you?
What?
Yeah.
You're a brave woman.
I know.
It was a good night out, yeah.
It gets upsetting thinking that it might not ever happen. Trying not to. Oh God, you set me off now. I just don't want that to be the end result. That's the only thing.
What if it is?
I've not really thought about it. It's not something we've spoken about.
Do you two talk about this much together?
Not as often as we should, no.
Why not?
Mainly because Kevin doesn't like really talking about anything.
No. Are you not a talker?
Not in as many words, yeah.
Why?
Again, it's just because it's such a touchy subject, and well, you can see how upsetting it can be. Sometimes I just avoid it rather than face it, probably. Obviously, it's probably out of my comfort zone, really, to talk about feelings and all that sort of thing. I'm a Glasgow boy, sort of supposed to be a bit more macho and stuff like that, but obviously no really talk about feelings and stuff, so it'll be all right.
There are some things that are giving me a little cause for concern.
Yeah, alarm bells.
You know?
Yeah.
It's not to say there aren't solutions, but those solutions might not, say, be suitable for you. I think it would do you a lot of good, really, to get some time with a gynaecologist. We'll be able to initiate some tests and things for you as well. Talk through everything, listen to his opinion on things, listen to treatment possibilities, and then I'd like to see you at another stage and hear your thoughts, hear what you've been told, and try and help you sort of come up with more of a plan. How about that? Yes?
Having a family means everything to me. It means everything to us. And we just want that little family unit together. And it feels like there's just a brick wall getting in the way, that is just stopping us.
Hello. Okay, thank you very much. Okay, Darryl, you can go through to Dr. Angelica now, the specialist.
Okay, thank you. Even though if people say you look fine, you look great, I just don't even believe it. I'm constantly paranoid. It's just always in the front of my mind all the time. Hi there, Darryl, nice to meet you.
Hi, come in, come and take
Thank you so much.
Hello, nice to meet you. He's 24 years old. He's got the world ahead of him. I think if he doesn't get surgery or finds a way to help him, he's never going to get the chance to be this great, confident person, which I know he can be.
This keeps it all in one place.
Yes, like Bridget Jones' pants.
Yes, yes. So it's like...
Just relax. So what do we have at the front? What is the problem at the front? What is it that you don't like? Show me.
It's basically, like, I can pull all of this up.
Right, so it's...
So that's my tummy tuck.
It's here.
I can't really get much of a benefit from it because all this sticks out.
Actually, the breasts are not that bad
It's
from
mostly
what
the sides of my chest and round my
what
back.
you have done. Okay, and let's see at the back. It's this part here, isn't it? Yes, with the stretch marks. Yeah, okay. You've got a big fold. All right, let's have a chat about it. Okay, so I see what you mean. So there is definitely extra tissue left following the weight loss. The question is what to do about it. I would like to say that you have done very well.
Thank you.
For losing that weight. So, others, when they have lost the amount of weight that you have lost, have a lot more folds and a lot more extra skin. So I think you're still holding on a little bit to your old self as a protection, because your body actually is not that bad if you think objectively. From my experience, what I would recommend is to, at least at this stage, to avoid surgery. Obviously, it is possible to cut away parts, but then you will have quite a lot of scarring in the upper part, which would a little bit defeat the object of you taking your shirt off. It is worth considering whether perhaps you can tone up a bit more, because I feel that you could still do quite a lot in terms of adding muscle volume in the upper part of the body. And just cutting the skin away is not going to give you a nice shape. You need to have the muscle or some muscle underneath it.
Okay.
Perhaps at a later stage, and when you develop some of the muscles underneath, what I would recommend is to try with liposuction, and we can use quite extensive techniques to try and reduce as much as possible the fatty tissue.
To be honest with you, I was expecting today to be recommended to a surgeon, and the surgeon will say, yep, we'll have a look at you here, and we'll cut this part off, we'll cut this part off, and yeah, you'll be fine and dandy at the end of it.
I think it's for the best. Makes sense, just to get a bit of muscle, just a little bit of muscle. Hello, Angela speaking.
Angela, I am ready for Rhiannon, and let's have Danielle as well.
Okay.
Both. Thank you.
No problem.
I have been to every doctor, I have tried everything.
Come in.
I am just hoping today Dr. Christian can give me a diagnosis and I can finally take control of this so I can get my life back again.
How can I help you, Rhiannon?
So, I've been suffering with some kind of stomach illness. What I find is that I get extreme bloating and trapped wind, which builds up over time, which gets worse and worse. And I find that sometimes it's stretched like to the point where I look pregnant. Sometimes I get really bad pain with it as well. And I find that after I eat, it gets worse.
How long has this been going on for?
I'd say it started about 3.5 years ago, but it has got progressively worse within the last year, I'd say. I have it every day now, and it just gets so bad that it is so unbearable and uncomfortable. The trapped wind will build up, and the bloating will build up over a few days, and then it will like just come out as diarrhoea.
Yeah.
When it comes out, it doesn't seem to release it much for the amount of bloating that there is. But then when it comes out, I feel better for maybe a couple of hours, and then it builds up again.
How many times a day are you going to the loo on a bed?
It can be up to like 8.
8 times,
Yeah.
with diarrhoea?
Not always, but it is quite like loose. It's not like normal.
Okay. What do you think is going on?
I've not been given an exact diagnosis, but I've been told I've got IBS-like symptoms. I think there's some kind of trigger, and I did think it was food, but I've tried all these diets and just none of them seem to work.
And what about relations between you guys then?
So it does affect us because she doesn't feel comfortable. She's in pain. She can sometimes be doubled over in pain.
Yeah.
And she doesn't feel, what's the word?
Not confident.
Yeah, not confident. She loses her confidence in herself.
I definitely do see a future for me and my boyfriend. We've spoke about marriage. I'm constantly worried that I might lose him because I feel like he wouldn't want to be with me with this embarrassing illness.
What are your worries?
I think it's just not knowing what it is, really. I don't know, I just feel disgusting.
Really?
Guys, have you ever like farted in front of somebody before?
Have I what?
Farted.
Everyone farts.
But in front of somebody? Philomena, do you ever let out cheeky farts?
And then look around afterwards.
Yeah, like, oh, I didn't do that.
Where'd that noise come from? No.
No, Maddie? No. You guys are liars.
How much do you think has the anxiety and the worry taken over things?
I don't notice it, but I think maybe it has a bit deep down.
I have. I've noticed it. Compared to what she used to be, she used to be a lot more confident.
I'm just worried that it will never go away and, you know, that I'll have it and it could even get worse.
There are sort of various types of IBS, irritable bowel syndrome, and that's what that is really, is it's a sort of hypersensitivity of your gut wall, often to stretching. So any sort of stretching sensation is particularly painful in people with IBS, but stress plays a really big part in it. So when you're stressed and anxious, IBS is nearly always worse, okay? The one thing that's a little bit odd for me is the number of times you're going to the loo and the fact that your poo is nearly always quite loose. And I just, you know, we want to just look into that a little bit more. But that's why I've sort of organised some other tests for you. And I think definitely I want you to see a gastroenterologist to talk things through. And hopefully she'll give you some good tips as to how to better manage it. Is that all right?
Yeah.
Yeah? Good, all right.
It just feels awful, you know. just difficult for me to have a normal life now, unfortunately. I'm constantly worrying about it. I don't know what it is. I don't know how to get rid of it. Just upsetting. It's affecting my relationship as well.
Look at some more kitchens.
I want us to have a little happy family, but it just feels like it's just not happening right now. I think it would be soul destroying to find out that I'm never going to be able to carry my own child. I can't even explain how I would react.
Hi, how do you? How are you?
Hiya.
I think Danielle would be one of the best mums that you could probably ever ask for. I mean, she's so loving and caring and everything, you know. I think she'd be a great mum.
Okay, so what brought you here today?
Well, basically, I was tested for polycystic ovaries, and they confirmed that I had that at the point, and said not to worry about it and to deal with it later in life when I'm ready to have kids.
And later in life is the ripe age of 26?
Yes, that is correct.
Okay.
And now we're here.
Okay. So we've got some investigations that you've had. You had a scan and some blood tests? Yeah?
Yes, that's correct.
So the conclusion was that there are some features of polycystic ovaries. The uterus itself, there's no abnormality of the uterus, and there's no other abnormality in the pelvis. So fertility in the longer or medium term should be something that can be achieved. So it's an excellent result. It's a great result.
Everything seems a lot better than what we thought.
Yeah, we were anticipating a lot worse news.
It was really great, to be honest.
I think that was just my main worry, coming here and then being told I'm never going to be able to have kids.
No, not at all.
Okay.
I would be very reassuring around the fertility, honestly. It's not going to be...
Impossible.
No, not at all. And that's what you're worried about, I think.
Yeah, that was my main worry.
Yeah. With polycystic ovaries, there's an association with weight. You need to lose weight because sometimes losing weight corrects everything.
Yeah.
That's usually the absolute staple thing we say with people who've got polycystic ovaries and have got a high BMI, because I think you've got to consider when you do get pregnant, there are complications in pregnancy which are higher when your BMI is higher. Yeah. Okay? All right. Well, thank you very much for coming. I'll just show you out to the waiting room.
No, that's fine.
Thank you.
Thank you very much.
Okay.
It was nice to meet you.
Good to meet you.
Thank you.
Thanks a lot.
Okay.
Cheers for
All
that.
right, cheers now.
See ya. Yeah, it was positive news that basically I'm fertile. I've got a battle on my hands because obviously I've always struggled to lose weight, and now I've got the battle of trying to lose weight over the next couple of months, couple of years, however long it takes.
That's quite good news though, isn't it?
It is, yeah, but it's still going to be difficult.
Of course it's still going to be difficult, but then at least you know that that's there and everything, so obviously it's a whole lot better news that the polycystic ovaries isn't as bad as it looked.
Yeah, we just need to sort the weight.
Yes.
Such a knob.
Hello? Okay, thank you. Okay, Darryl and Laura, you can go through now. Second door to your right.
Come in.
Hello.
Hello.
How are you?
Laura.
Yes, nice to meet you.
Nice to meet you too. Come and sit in that chair there for me. Darryl, how are you? Welcome back.
Very nice to see you again.
We've put you through the ringer today, haven't we, really? Come and
Thank you
sit
so
down.
much.
I'm very aware of that, you know. I'm very aware that stripping you off and having a look at you is not easy for you at all. Tell me what you thought of what my surgeon said to you, your thoughts. You can be as honest as you like, happy, sad, disappointed, ecstatic.
Like, being honest, it wasn't the result what I thought it was going to be. I thought I was going to come in and get my skin taken off.
Do you remember, taking skin off is quite a brutal, big procedure. And it's not a very neat outcome.
Yeah.
You end up with great scars all around the place. It's quite a mess. I think because your expectations are sort of slightly all over the place, and you've had quite bad experiences in the past, I would also like to help you up here as well. And now what I'm talking about is something, is like a psychotherapy of sorts to get you more comfortable with you. And I'm not saying that is the only answer, it's not, but I think you could definitely benefit. There are a number of things that are going to help you feel better, but surgery alone is not going to do it.
Yeah,
all right?
yeah, completely, yeah.
Okay. And Laura, you know Darryl better than anyone, probably. What do you think about what we've suggested?
I'm not that surprised about the psychotherapist because obviously he's a very good looking guy and I have to give him constant reassurance that he looks absolutely lovely.
Yeah.
So I think maybe it would be beneficial to you.
And you need a better outlook on
Yeah.
life. You need more confidence. You know, as Laura says, you're a very good looking guy. You shouldn't be hiding away in a dark room of a night, doing whatever you might be doing.
Yeah, I just want to be a normal Joe Blogs, you know.
That's what the psychotherapy is going to help you with most, is because you probably haven't been the person you want to be for, well, ever, or for how long?
It's for as long as I can remember now.
You know, and that's a big deal. That's not, an operation is not going to put that right.
Yeah, yeah, no, I think you're right, yeah, you're right.
It's annoying, isn't it, when I'm right? So do you think today's been useful for you?
Yeah, most definitely useful.
Yes.
Yeah, I feel really, really good about today.
You do?
Yeah, definitely, yeah. Good. By the end of today, I was expecting just to have my skin taken off and this would be the answer to all my problems, but I've realised that within myself that that's not it. Surgery's not just the quick fix and hooray, you're going to be feeling better within yourself.
No.
So with the psychological help, I think that's going to be really beneficial.
Good. Nice to see you both. Thank you for coming. Let me take you out. All right.
I feel as if a big weight's been lifted off my shoulders now, and I didn't really think that I had something wrong with me psychologically, and I believe that now.
Thank you very much.
Thank you, cheers. Thank you.
It's not just a matter of quick fix surgery. It's not going to be an easy road, but it's going to be a productive road and it's going to be definitely steps in the right direction. But I'm there every step of the way, and I think that he's got the best chance in the world to get the desired results that he so longs for.
Thank you, take care. See you later. I can kind of see the finishing line in the distance now. Yeah, I'm happy with the way it's going to be going. I think this is going to be life-changing for me.
I do like my muscles. You like muscles?
No.
Do I like the concept?
No.
Tried kangaroo.
No, I couldn't eat that.
Couldn't eat kangaroo?
No.
Ostrich burger. I've tried an ostrich burger as well.
No, I couldn't eat that.
I wouldn't mind trying snake. Really? Huh?
I see my face. Hell no.
Mum used to have 2 pet snakes.
Your mum?
Yeah. She had to get rid of them when I was born because one of them was 14 feet long. And she had to get rid of it because she was frightened it was going to eat me.
Eat you.
It was costing her a lot of money as well because it was getting to the point where she would have had to feed it baby piglets.
I'm going to start scanning you. That's all right with you?
Yeah. It's just difficult to lead a normal life now. I just can't do anything anymore. It's just affecting me more and more, and I'm just worried it'll get to the point where I'll be like housebound with it.
Hello. Hello. Come on in, I'm Lisa Duff. Nice to meet you.
Hello, Rhiannon.
Nice to meet you. Come and take a seat.
It was coming to the point where Rhiannon was like, this is what it's going to be for the rest of our lives. It's going to be constantly thinking about this illness. So it just makes me feel angry.
I believe Dr. Christian's wanted you to see myself because of your stomach problems.
Yeah.
Is that right? How do the bowels tie in? Have you ever seen the Bristol stool chart? I was just wondering if... yeah? So how would you describe it? I mean, obviously this is watery down here. It's about 6.
Yeah.
Is it ever 2?
No.
Never? So you don't have a solid bowel movement?
Not very often
Not
at all.
very often. Okay. The ultrasound scan that you had done is to look at the abdominal organs, so the liver, the gallbladder, the kidneys and the pancreas. Really, we do these scans mostly to make sure that there isn't anything like gallstones causing the pain, something else that could contribute. This is looking at your bladder. That's your kidney. You can see the shape of that. That looks great. This is the liver. Looks fine. There's no abnormal masses or lumps and bumps. So this all looks completely fine. However, I think it's worth probably investigating a little bit further, especially when it's not getting better with any of the things that we've tried. I think there's 2 other things that we need to do to fully evaluate, and that would be 2 breath tests for small intestinal bacterial overgrowth. So we can organise those for you. And at the same time, I think we should probably do a colonoscopy, which, as you know, is a camera test to look inside the bowel. Hopefully, by excluding these other things, we can at least make some inroad into treating you a bit better. Do you have any questions about those tests?
Just glad I'm getting this done,
Something's being done, finally.
Good. All right. Very nice to see you.
And you. I thought I might have something more seriously wrong with my digestive system, but I wasn't exactly sure what, but now my mind's been put at rest from the ultrasound.
Hey guys.
There is a lot of hope for me now. There's a lot of different options that I can consider. They're the two things I wanted to have done, and I've been asking the doctors for 3 years, and now I've got them done in one day.
I really need to lose it is. I don't know why my stomach keeps rumbling. Is my stomach talking to you?
Made me cry.
Hi, Danielle. Do you want to both come and see?
Yep.
How are you?
I'm all right, you?
I'm very well, thank you. You remember the way now, don't you?
Yep.
Come on in, Danielle, come sit in here for me. You had a chat with the gynaecologist?
Yes.
Tell me all about it. How did it go? What did he say? What did you think?
More positive than negatives. The weight is the main issue, obviously, and then once the weight's controlled, then look into obviously the fertility side of things.
It's good news that none of us really see any issue why you can't get pregnant.
Yeah.
The bad news is it's now just over to you, sort of thing, isn't it?
Yeah.
And I know that people can struggle with that, and I know you struggle, and it is harder, but I think, you know, if your goal is to have that baby, that's your ultimate motivator. How confident do you feel about being able to do this, being able to get your weight down?
I feel more confident than I did, a lot more confident than I did, but obviously in my mind it's still stuck that I'm going to struggle because I've always struggled with my weight. It's just me physically, I don't like the way I look sometimes, so to go into a gym, sometimes a busy gym, and work out with people around me, it makes me feel uncomfortable and not want to do it.
I suspect there'll come a time when you just have to go, do you know what, I really don't care what other people think. This is not about them. This is about me and my life and what I want. As I say, it's up to you. It's so up to you with your help. I think it'd be really good for you to talk a little bit more as well, don't you?
I try sometimes, I do try, and it's like Kevin has this shutdown mode, and he will just sit there with a blank look on his face.
Is that because you don't know what to say, or because you feel awkward, or...?
A mixture, probably. Yeah, sometimes I just don't know what to say, and then if I do say the wrong thing, it could...
But I'd rather you say something than nothing. It's when you say nothing that it frustrates me.
Yeah. But you see, you're talking now. Yeah. And you probably never had this conversation, have you?
Probably not said as much, no. Yeah.
The communication about this really is as important as everything else that's going on. You need to talk to each other and understand how you're going to understand the moodiness a little bit more. You'll understand his frustration a little bit more. You'll talk about the future more, and that's a good sort of life skill to have in general, really, I think, in a relationship, isn't it? So I'm going to have to charge you an extra £50 for that advice. All right. But are you happy then? Do you feel you got what you wanted?
A lot happier.
Yeah?
And hopefully in a couple of years we'll have a little sonogram photo to send you.
I want to see that. I would love to see that. It would make me very happy.
Get
Can
that
I
far.
recommend Christian as a name if it's a boy? Very good name.
Maybe a middle name.
Guys, thank you very much for coming. Well, nice to see you both. All right, back down to reception. Okay, bye-bye.
Thanks a lot. See you later. I could actually see the relief in Danielle's face when the doctor told her that it would be possible for her to have kids, so that was really good, and that made me feel good as well.
How did it all go?
Yeah, really good.
I'm happy to hear that.
I thought I'm going to come away being told that I'm never going to be able to conceive, but knowing that that's not the main issue, that's positive. Like, it's just the weight that needs to be looked into right now, and then hopefully in a year, 2 years, however long it takes, the positive outcome is we have a baby. Oh, it's cold.
I'm leaving here quite happy, very happy actually, and just sort of can't wait to Oh no, I was going to say can't wait to get started, but that sounds a bit wrong.
Hello, Angela speaking.
Hey Angela, I will see Rhiannon and her partner again, please, Danielle. No problem. Thank you. Bye. Come in. Hey, come on back in. So, you saw my consultant gastroenterologist, Lisa.
Yes.
So you're going to get a few more tests and your scan was all normal, which I hope is reassuring and you don't think there's anything terrible going on. You came in and you looked quite sort of anxious, actually, when we were talking before. You didn't look terribly happy. And I understand why that is, but you do look quite a lot happier now, and we haven't even done anything.
I know, I'm pleased.
How
I'm
come?
just pleased it's moving forward, and there's all these different options. I'm just hoping one of them will work, or at least I've tried them. Yeah.
I hope so. I don't want you worrying that we're missing things either, because that's not going to help, because as you now know, that sort of worry and anxiety and stress is all making things worse. I know when people have issues like this, I know that you worry about how it will impact your relationship and how it will impact on the way he feels about you, won't you? And that's probably part of the anxiety that goes along with all of this. Is that right?
I don't think my body looks nice anymore.
Do you think it feels worse than it looks?
Possibly a little bit.
Well, I mean, Daniel, you could tell us that. And what do you see when you look at her?
Well, I see the love of my life, first of all, but it's the case of that she doesn't look unattractive to me at all. I wouldn't say it if I didn't believe it. So, when you think that you look bloated and you look pregnant and things like that, you shouldn't think that I believe that, because I don't. I've thought you gorgeous since the day I've met you. I've called you gorgeous since the day I've met you. So you don't need to be thinking in that sort of way, especially when you're around me. You don't need to be thinking that you're anything but what I see you as.
You've got to listen to that, because that can be a really important part of your getting better. And of course, as we manage to get things more under control medically, so you will start to believe a little bit more. But start from today, might as well. Okay. Yeah?
I'll try my best.
So, we will organise those follow-up tests and things, all right? And we'll take it from there. Nothing nasty now that you need to worry about. So I'd love you to start getting on top of that sort of anxiety that goes on, and not preempting that you're always going to get ill, all right? It really will help you.
Yeah.
It really will. Okay? And you'll let me know how you get on.
100%, yeah.
Good. All right, guys, thank you so much for coming in.
Thank you very much.
My pleasure, my pleasure. Let's take you down.
Thank you for your help.
Nice trousers too, I like those. Thank you. I'm gonna have to get myself some of those. See you soon, guys. Bye-bye.
See you soon. She seems a lot more relaxed now. I mean, we didn't know that anxiety even was part of it, really. So that's a huge step in the right direction.
How did it all go?
Very good, thank you.
I think the future holds anything that we want, really. If we can control this illness more and we can control our anxiety more, then we can do pretty much anything we want. Cheers, thank you.
Yeah, I definitely feel more secure in our relationship, because I need to try to put the anxiety to one side with, feeling not confident, and listen to Dan more, and I think we'll get stronger because of that.
I've now been seeing Anna, which is a psychologist. I've been seeing her weekly, basically, for the last couple of months. And I feel as if my confidence is starting to come back again. And I'm just definitely looking forward to the future and getting on with my life.